Good morning, guys. I'm going to tell you all a little story. Try to make it as concise as possible from the time that I had a teratoma. What? Sounds so scary, right? If you don't know what it is. Oma, by the way, in the medical world just means tumor, mass, lump, ball, whatever you want to say. And so there's different kinds, and there's benign, there's cancerous, there's precancerous, or there's lipomas, which are made out of fat. Anyways, oma just sounds scary, but it's really not. It's just short for a tumor or a lump or something abnormally growing in your body. The other word for teratoma is called a dermoid cyst. Dermoid stands for germ cells that are changing into another part of your body. And so that dermoid cyst being a lump composed of fluid, had dermoids in there that started to change and grow. And teratomas or dermoid cysts are pretty much hair, sebum, and sometimes teeth growing inside a cavity called a cyst. And because it's not completely composed of fluid, and it also has hair, sebum, and sometimes teeth, it also has adopted the name of teratoma. Summer of 2022, when I was in PA school, I had been taking earlier in the year, maybe spring semester, I was taking an OBGYN class. They were teaching us all about the cysts, all about tumors. And when we got to the cyst part and we were learning about dermoid cysts and teratomas, I was like, oh, so gnarly, that is so weird. Imagine if I had one. It's so crazy for me to say that now because it sounds almost fake. But in the moment, I said to myself, imagine if I had one. And I honestly don't remember if I was already having pelvic pain at that time or if it started after. Maybe that is why I thought, imagine if I have a cyst, because obviously the symptoms are pelvic pain. Anyways, time went on, my pain increased, and in the summer of 2022, after my pain had been going on for many, many months, and I was uninsured and broke, I decided to finally opt in for insurance so that I can get an ultrasound. And I went to an OBGYN. I explained to her my concerns and all of my symptoms, and she thought it was normal. She thought it was ovulation pains. That was my very first time seeing her. Granted, this had been going on for months. And my pain would come and go. Honestly, it was never to a point where I could pinpoint, like, it was 14 days after my cycle, it was definitely menstruating. No, it was always coming and going. And by the time that I got to see her, because applying for insurance took a really long time, I forget I need to be packing my lunch. By the time that I decided, you know what, my pain is not going away, I should probably do something about it. Like, every good patient nowadays, just not everyone, but a lot of patients probably say, I'll just wait for it to pass. It'll go away. Well, I waited a long time, had to wait for insurance. By the time my appointment came around, my pain was less and not really as prominent as it was in earlier months. So, anyways, kept my appointment. She was dismissive, like I mentioned, but I insisted that I should at least have an ultrasound just to make sure nothing is abnormal, because the pain was there. It was just not as persistent and not as severe. And so kind of had to push to order me that ultrasound. Fast forward, I got the ultrasound done. Obviously, the radiology tech isn't allowed to tell me anything, but I did see, like, she turned the screen away from me, and I immediately had a gut feeling like, oh gosh, something is probably wrong. Nerves up through the roof. And when I asked to get my ultrasound, I think I was able to see it myself on the patient portal, and you could clearly see, I'll put my results on here, how one ovary was much larger than the other one in size. And the composition of it was, again, I'll put it on here, I can't quite remember, but I knew it wasn't normal. So when I reached out to the office and I asked them why my provider hadn't reached out back to me about the results, the nurse told me that my provider said it was normal, that your ultrasound came back normal. There's nothing for you to do. Well, clearly, my ultrasound report, which is very important why you get it, was not normal. And at that time, I was in my first rotation of PA school in internal medicine, and Dr. G was very kind enough to literally walk me over next door to the OBGYN that worked there. Granted, it was a great friend of his, he had actually trained that OBGYN, and that's why I knew he was going to be a good OBGYN. So he walked me over, I took him the ultrasound result, he wanted to repeat it again. From maybe month 1 to month 2.5, that ovary hadn't grown quite much. And the reason why I wasn't in that much pain is because that ovary was already so big, baseball size, 8 centimeters, and there was not much torsion or moving going around as when it was much smaller and it wasn't as heavy. So when cysts are heavier and larger, they tend to just sit and they don't torse your fallopian tube. What causes the pain is that torsion of the fallopian tube. And sometimes your body naturally even reverses it back to its place. But if that tube is twisted, just imagine that twist. That's what causes pain. And ovarian torsion can be very detrimental. So you can block obstruction of blood flow. Your ovary can essentially just die and become necrotic, which is no blood flow. And it became very scary for me to imagine how many times my ovary was torsing. Granted, ovarian torsion is ER pain. And you know when your body is under that much pain, you know when you need to go to the ER. I tell a lot of my patients, your body will tell you, you know when you know. And thankfully, I have never been in that much pain. Well, maybe once or twice. And I was so close to being in the ER. So if your pain is, I hate giving out scales. It is helpful as a provider to get a number from 0 to 10, but everybody's pain scale is different. If you are on your 9 or 10 out of 10 pain and you can't wait for an appointment, it's always better to go to the ER and avoid a further complication, losing of an ovary. Thankfully, going back to the story, mine was about 8 centimeters and I needed to be scheduled in to do surgery. I believe that any other OBGYN would have maybe saved themselves the trouble of reconstructing my ovary, of going in there in detail and extracting the cyst/teratoma. And they would have probably, I can't say for sure, but I think like a lousy job and a lousy physician really makes a huge difference in your healthcare, in your health, in your future. And who knows, maybe that ovary could have been gone if I had gotten to the other OBGYN that said my ultrasound was normal. Maybe she would have just cut it entirely. Thankfully, my OBGYN went in there, scheduled me in on a time frame that I was in between rotations. I took my end of rotation exam a bit earlier so that I can go into surgery during the off week and just rest before I was required to attend my second rotation, which was in Austin. The surgery went pretty successful. It went longer than expected because he wanted to ensure that he was reconstructing my ovary, which was very mindful of him, and I owe him, because who knows, if I would have had one less ovary, that's 50% chance of producing an egg and ovulating. So that's the story of how I found out I had a teratoma.